Patient is awake, alert, and oriented times 3. Patient stated having no recent change in weight. The patient stands with shoulders back and does not slouch. There are no physical deformities present, and patient's gait is stable without the use of a cane or a walker. The patient has a broad affect and is in a good, stable mood. Patient is well groomed with no odor, and the hair is kept and groomed. Patient is understandable with no slur or stutter in the speech. Upon inspection of the skin, the patient's color is tan to pink in color, warm, dry, and intact. Skin turgor is less than 3 seconds. There are no bumps or lesions on hands. Patient has acrylic nails, so I did the capillary refill on her toes, which was less than 3 seconds, and there was no clubbing noted. The radial and brachial pulses were present upon palpation, and the patient's head and face were normocephalic with no bumps or lesions, and there were no signs of scaling or lice on the scalp. Upon palpation of the skull, patient stated having no tenderness. The facial cranial nerve assessment, cranial nerve 7, showed a symmetrical face with no weakness or involuntary movements. In the external ears, there were no masses, scaling, discharge, or tenderness to palpation. The ears were symmetrical to each other. The vestibulocochlear nerve, which is the cranial nerve 8, showed the patient had no hearing loss, and the whisper test, where she stated the words 5, B, and 6 were heard and repeated bilaterally. Upon assessment, the nose there were no deformities or tenderness to palpation. The patient's nerves were patent bilaterally, and the mucosa of the nose is pink, and there were no lesions noted. The septum is midline, and the patient had no perforations. While doing the smell assessment for cranial nerve 1, the patient was able to identify the coffee smell. The patient stated having no pain in the mouth or toothaches, and the gums were not bleeding. There were no sores or lesions in the mouth or the lips noted. The mucosa and gingiva of the mouth was pink and moist. The patient's uvula rose midline when the patient said "ah," and the gag reflex was present during the glossopharyngeal and vagus nerve assessment for cranial nerves 9 and 10. During the hypoglossal nerve assessment for cranial nerve 12, the tongue was midline and no tremor was noted. The hard and soft palates were pink, moist, and intact. The tonsils were rated as a 1+. While performing the assessment on the posterior thorax and lungs, the AP was less than the transverse diameter, and the chest expansion is symmetrical. Patient stated having no CVA tenderness or no pain upon palpation. While palpating the temporal arteries, there was no abnormal tenderness or firmness, and upon auscultation, no bruits were noted. The TMJ assessment for cranial nerve 5 showed muscles were equal on both sides, and the jaws did not separate when pushed down. The maxillary and frontal sinuses were non-tender upon palpation per patient. The patient's neck is symmetrical with no masses, tenderness, pain, or lymphadenopathy. Trachea was midline, and the thyroid is palpable and non-tender as stated by the patient. The carotid arteries are equal and are noted bilaterally, with no bruits heard upon auscultation. The periocular, posterior ocular, occipital, submental, submandibular, jugulo-digastric, superficial cervical, deep cervical, posterior cervical, and supraclavicular lymph nodes were all non-tender and were not painful per the patient. The spinal accessory nerve for cranial nerve 11, that includes the sternomastoid and the trapezius muscle, were equal when applied against pressure. The optic nerve for cranial nerve 2 showed a visual acuity that was full by confrontation. The oculomotor cardinal fields of gaze for cranial nerve 3 on the patient showed bilateral pupils that were equal, round, and reactive to light and accommodation. Patient had no crusting, discharge, or lid lags on the eyes, and had clear conjunctiva. The sclera was white, and there were no lesions or redness in the eyes bilaterally. The pupils were 3 millimeters resting and 2 millimeters constricted, and they were equal bilaterally. There were no adventitious sounds noted upon the posterior or anterior auscultation. While performing the assessment of the anterior thorax and lungs, the patient had a respiratory rate of 16 breaths per minute and a regular pattern. The patient's posture was relaxed, tactile firmness was present and equal bilaterally, and there were no lumps, masses, or tenderness noted. S1 and S2 were heard upon auscultation of the heart and were not diminished. There were no S3 and S4 sounds noted. The apical impulse was felt and noted at the fifth intercostal space in the left midclavicular line. The aortic, pulmonic, Erb's point, tricuspid, and mitral heart sounds were heard upon auscultation in the supine and in the left lateral positions. The abdomen is flat and symmetrical and has no lumps or lesions. Bowel sounds were present in all four quadrants, and there were no bruits heard. Upon percussion and palpation of the abdomen, the patient stated having no tenderness or pain. The patient's lower extremities are symmetrical and tan to pink in color, warm, with no redness, cyanosis, or scars. The patient has a birthmark on the left thigh. The hair was shaved, but it was distributed evenly. The peripheral pulses were present ×4 at a 2+ rating, and they were equal bilaterally. The patient is able to maintain resistance and tenderness and has a full range of motion bilaterally in the hips, knees, ankles, and feet, and this is also the case in the upper extremities. There were no deformities or curvature while performing the scoliosis screen, and the patient had a negative Romberg sign, and the patellar reflexes were present bilaterally.